Hello, everyone. We are Group 3, and we will be presenting on school telehealth today. I want to start out with a general introduction to the problem. Children all over the country have limited access to healthcare, especially for routine preventative care and chronic illnesses such as asthma, diabetes, and obesity. This problem is only exacerbated when we talk about access to mental health professionals for school-age children. For children that do have access to receive care or have assistance managing their health conditions, they almost always must be taken out of school to see a doctor or a health professional. So why are we talking about telehealth? Introducing telehealth to schools could expand healthcare access to all school-age children, since all kids have to go to school anyway. If they're able to see a doctor and to take care of their health at school, all children would have some level of access to healthcare. It could also improve quality by providing on-demand care and regular assistance for managing diseases. And finally, it could increase attendance in schools. This problem affects a large variety of stakeholders and a lot of different people, ranging from the students and their families to school administrators, school nurses, doctors, insurance companies, and even the government. So how do we quantify this problem? There are 56.4 million school-age children in the US. 4 million of those children do not have healthcare. 1 in 4 has a physical chronic condition such as asthma, diabetes, or obesity. Another 1 in 4 has been diagnosed with a mental disorder. That's a large percentage of children that either don't have regular access to care or are having to be taken out of class regularly to manage their conditions. We need a solution to not only provide regular care to these students, but also to make sure that they aren't missing school and are still receiving a quality education. I want to share a quick history of what school health has looked like in the past. In 1902, the very first school nurse in the country was hired. Her name was Lena Rogers, and she was hired by the public school district in New York City. It was so successful that shortly after, the Board of Health hired 12 additional school nurses, and within 6 months, absenteeism had fallen by 90% within the schools that had hired new nurses. In 1907, the Education Act required periodic medical inspections in schools, which encouraged the schools to pay more attention to their students' health and to help take care of their students. In the 1930s, various organizations created formal agreements surrounding school health programs. And in 1946, schools were required to serve nutritious and hot meals to their students at lunchtime, mandated by the passing of the National School Lunch Act. You have probably all seen this in action growing up and firsthand eating school lunches. In 1968, school-based clinics became more commonplace when the school-based adolescent healthcare program launched. And then in 1994, the National Nursing Coalition for School Health was formed. So where does that leave us today? Despite these advances in the past, not all schools have school nurses right now, and in fact, 25% of schools don't have a single school nurse on staff. An additional third of those schools only have a nurse working part-time. So that means that only about 40% of students are provided with a full-time healthcare professional in their schools. Children in school full-time often don't have the support they need to monitor their chronic conditions. And then to receive medical treatment, parents have to take their children out of school, causing issues with attendance and limiting the quality of their education. We have programs like CHIP and Medicaid to help support children's healthcare access and reimbursement on costs. Overall, telehealth in schools has a broad market potential to affect over 56.4 million school-age children, and especially those in over 60% of schools without a full-time nurse on staff. Now, I'd like to pass it over to Ju to talk about the innovative approach of introducing telehealth to schools.
Thanks, Elsie. Now I will talk about what is the innovation and how success is measured. The innovative approach to address the above problem is school-based telehealth, which is turning the nurse office at school into a telehealth station. This offers access to care providers and specialists that enable students with chronic conditions to manage their care while at school. This also helps to identify behavioral issues and connect students with physicians through virtual visits. Is to bring schools and hospitals together to meet children's needs while not interrupting their school attendance. Atrium Health in North Carolina became the first healthcare provider to implement school-based telehealth. It is a service that targets on small schools in areas where poverty and unemployment rate are high, and insurance and access to primary care are insufficient. It also received investments and support from COS and Blue Cross and Blue Shield of North Carolina. Education enables students in that area to access primary care that they otherwise may not have. A disruptive innovation. First, it's a new way to organize and deliver healthcare service. Second, it satisfies the AAA model, in which it improves the quality of care for children at school, reduces the costs of having an on-site nurse office, and extends access to Medicaid for every child. To look at transformational elements for success, telehealth utilizes telecommunications as a platform to deliver contactless and seamless care to children at school. It's a solution shop model that delivers health consulting service either by homegrown or coordinated by telehealth companies. Spread of service established in multiple states. The service was altered to comply with school policies and legislative requirements of different areas. The network behind the service is to pool schools, healthcare providers, parents, and community leaders together to ensure every child has a chance at good health and a good education. I believe this is a successful innovation regarding the following measurements. First, it increases the school attendance rate. According to research, after implementing the service, the number of kids being taken out of class to doctors due to the 4 most common non-acute illness was reduced by 1/3. New health stations in California, 20% reduction in school absence rate, and a 30% reduction in students leaving class for chronic care needs. An increase in school funding that are generated by the increase in school attendance rate. School attendance rate is one of the indicators of school funding. With school attendance rate, schools can potentially receive more funding. And one is a clear reduction in unnecessary emergency visits. Before, students with no primary care have to visit emergency for any chronic conditions. The based telehealth will serve as the purpose of primary care so that unnecessary emergency visits will be reduced. Next is going to talk about the future of the industry.
Thank you, Ju. So today I'm going to be discussing the future of telehealth. Although it initially seems to have promising success rates, there is some concerns with its potential adoption, and that in the long term, there might be unintended consequences of telehealth. One, school nurses might be replaced because telehealth, in directly communicating with primary care physicians, may displace nurses, and that you might just need a supervisor to facilitate this communication. In addition to this, you might have a decrease in quality of care in that with virtual healthcare, it creates the possibility of inaccuracy. When physicians don't get a heartbeat or can't get a closer look at a body part to diagnose, this affects the treating process. Then in turn decreases the quality of care. The positive long-term potential is that it may alternatively increase the quality of care by having students who wouldn't otherwise have access to primary care physicians. This does, however, create some segmentation because students who initially had access you necessarily need these telehealth services. But then also by giving access to students who don't have access to primary care physicians, it helps alleviate certain disparities with students that come from different socioeconomic backgrounds. Another point to mention is that preventative care implementation by managing conditions is a long-term potential of telehealth services. This is because you are better able to keep up with students' underlying medical conditions, which then in turn can decrease the amount of emergency care use or urgent care use. The collaborative element of telehealth within academic settings will determine the positive long-term potential, because working collaboratively can better meet the needs of student rather than one person managing health of a student. We see this with physicians working alongside with other physicians and having a diverse amount of perspectives on a certain diagnostic. The potential broad adoption with telehealth may be used in other institutions, namely universities and workplaces. This is important to mention because this might incentivize certain employees joining the labor force or students to attend a specific university, come work for a specific company, or attend a specific university, because they now have greater access to a primary care physician. The option that I want to bring up is that with behavioral health treatment, especially for students, requires parents' consent. With a particular ailment, for example, a broken bone, you don't need you only need the parents' consent at the beginning of the academic term. But behavioral health treatment, you need it in real time at the time of diagnosis. Up is that parents refusing to sign consent forms, primarily because they have primary care physician preferences. Reputation of a primary care physician is something they account for, and longstanding relationships with primary care physicians. Medicaid reimbursement and lack of funding from Medicare programs is something that might create a barrier to adoption, and that these are the mechanisms that allow telehealth services to be implemented. With sorts of funding, you won't have telehealth services in schools. With that being said, there is a greater point to bring up in that telehealth services is very general. This can be used in different contexts and settings. You can be using telehealth services in retail clinics, having patients come to these clinics to use these telehealth services. Also, and the innovation in itself is not a new system, but rather a disruptive form of communication. The diagnostic process still stays the same. The treating process still stays the same. And the only thing that changes is the form of communication between the primary care physician and the patient. With that being said, expect the telehealth services to enter the realm of medical services.